UCSF Liver Transplant Program Post-Liver Transplant Module. Hello, I'm Jennifer Catamartori. I'm one of the post-liver transplant nurse practitioners at UCSF Medical Center, and I want to say congratulations on your liver transplant. We know this has been a difficult process for you and your family, and we want to do everything we can do to help you regain your health. This DVD goes over the information you and your caregivers need to know to care for your new liver. The topics will include medications, self-care after transplant, nutrition, reclaiming fitness, health maintenance, resources, and contact information. In the hospital, your nurse will give you this booklet, the Liver Transplant Patient Handbook, and begin to teach you as soon as you and your caretakers are ready to learn. All the information you need, including the liver transplant phone numbers, are in the handbook. At first, it may seem like a lot of information to absorb, but with time and repetition, you will be ready to care for yourself at home. Ask your nurse, the members of the transplant team, or your post-transplant nurse practitioner any questions you may have. We are here to help you.
Medications. Hi, I am David. I am one of the transplant pharmacists here at UCSF Medical Center, and I will be discussing medications with you today. You'll be taking somewhere between 8 to 14 medications when you go home after transplant. Some will be stopped after a few weeks to months. The medications include immunosuppressive drugs to prevent rejection and antibiotics to prevent infections. Each medication is individually prescribed for you and documented on a green medication card. During your hospital stay, your nurse will prepare your green medication card for you. On it will be a list of medications, the doses, and when to take your medications. You and your caretakers will use the card to learn the purpose of the medications. In the clinic, we will let you know if there will be any changes in the doses of your medications or when certain medications can be stopped. It is very important that you do not suddenly stop taking any of your transplant medications without asking first. After transplantation, your body recognizes your new liver as foreign. To prevent rejection of the transplanted liver, you must take anti-rejection medication, also known as immunosuppressants. Right after transplantation, you will need higher doses when the likelihood of rejection is higher. Over time, the doses may be lowered. You may experience some side effects from the immunosuppressive medications. While not every patient will experience side effects, you should know about them and know how to manage them. Do not hesitate to tell the transplant team about any side effects or problems you have with the medications. Sometimes we can help to lessen the side effects. Medications often have several names. We will only use the actual name in this DVD. Every day you will be taking a combination of several anti-rejection medications, typically prednisone, mycophenolate, and tacrolimus or cyclosporine. Prednisone can cause tremors, high blood sugar, high blood pressure, and confusion. Mycophenolate can cause nausea, bloating, diarrhea, and low blood counts. Tacrolimus and cyclosporine may cause headaches, shaky hands, and kidney problems. With tacrolimus and cyclosporine, drug levels will need to be drawn on a regular basis. On the mornings of blood draws, bring your medications with you to the lab and have your blood drawn first. Take your tacrolimus or cyclosporine only after you have your blood drawn. You will need to take some medications to prevent infections after transplant. These include fluconazole, valganciclovir with the brand name of Valcyte, and trimethoprim sulfamethoxazole with the brand name of SEPTRA or BACTRIM. Fluconazole is used to prevent a fungal infection in your mouth called thrush. It is taken once a week and will usually be stopped when the dose of prednisone is down to 5 milligrams a day. Valganciclovir, or brand name Valcyte, is used to prevent or treat viral infections such as cytomegalovirus, cold sores, and herpes zoster. It is usually stopped after 3 to 6 months. Trimethoprim sulfamethoxazole, also known as SEPTRA or BACTRIM, is used to prevent lung infections and will usually be stopped after 1 year. Other medications you may be taking include aspirin, diuretics, also known as water pills, to help remove extra fluid in your body, anti-ulcer medications, and high blood pressure medications. Medication dues. Always use your medication card to determine the correct dose or number of pills you need to take. Do not follow the directions on the medication bottles, as the information on the green medication card will be more up to date. Bring your medication card with you to clinic. At the clinic, a liver transplant provider, nurse practitioner, or medical doctor may change the doses of your medications. The new doses will be recorded in pencil on your green medication card. Your nurse practitioner may call you at home with any changes in medications. Record any changes on your green medication card if a nurse practitioner calls you at home to adjust your medications. Take your pills at the same time and the same way each day. You can choose times that fit your lifestyle, but the medications should be taken at the same time every day. Your tacrolimus or cyclosporine dose should be taken 12 hours apart from each other every day. For example, if you take the morning dose at 8 a.m., take the evening dose at 8 p.m. You should also take the pills the same way each time. For example, if you take your medications on an empty stomach, do so that way every day. Medication don'ts. Do not take tacrolimus or cyclosporine before a blood draw. On days you need to have your blood drawn, do not take tacrolimus or cyclosporine until after your blood has been drawn. You should have your blood drawn 12 hours after you have taken your evening dose of tacrolimus or cyclosporine. Never take any new medications without letting the liver transplant nurse practitioner know. Medications prescribed by your local provider should be reported to the liver transplant nurse practitioner. Many medications change the effects of the immunosuppressive medications, including ibuprofen, also known as Advil or Motrin, erythromycin, clarithromycin, and herbal supplements. Never change or stop taking any immunosuppressive medications without talking to the transplant team first. Without proper doses of immunosuppressive medications, you can reject your liver or it can fail. Check with your pharmacist and transplant nurse practitioner if you have any questions about your medications. Plan ahead for prescription refills. Call for prescription refills about 1 week before you run out. What to do if you forget to take a dose of a medication? Take it as soon as you remember. If it is less than halfway before your next dose is due, just wait until your next dose is due. Do not double up on your medication. Be consistent. Always take your medications at the same time of the day and in the same way. There are two foods which will interfere with your medications: grapefruit and pomegranates. Do not eat grapefruits or pomegranates. Do not drink grapefruit juice or pomegranate juice. Always wash your hands before you handle the medications and after you handle the medications.
Self-care after transplant. As one of the transplant nurse practitioners, I would like to explain to you what you should expect as your daily routine after your liver transplant. You should plan on a daily routine similar to the one outlined in this DVD. Please review your liver transplant patient handbook for more detailed information. Weigh yourself in pounds each morning and record your weight in your handbook. Take and record your temperature every day. If your temperature is greater than 100.4, call your transplant nurse practitioner and tell them you have a fever. Take and record your blood pressure. If you are taking blood pressure medications, know your baseline blood pressure. Take a look at your incision every day and call your nurse practitioner if you see signs of a new infection. The signs and symptoms of infection are redness or warmth, tenderness or increased pain, drainage that is white, creamy, green, or has an odor. Wash the incision daily. You may take a shower and let the water run over your incision. Do not soak the incision in a bathtub or pool until it is fully healed, and you do not need to apply any ointments to your incision. Take your morning medications as specified on your green medication card. Bring your cyclosporine or TACROLIMUS with you to the lab on the days that you have your cyclosporine or TACROLIMUS levels drawn. Take your morning cyclosporine or TACROLIMUS dose after your blood is drawn. Take your medicines as ordered by the transplant team. Take your bedtime medications. Set your medications for the next day. Use a multi-chambered plastic pill box. That may be helpful for you. Activity limitations and prevention. There are some activity limitations that you should be aware of following transplant. You will likely need to limit physical activity for the first 2 months after your liver transplant. Discuss with your transplant care provider about what you may or may not do. For further information, refer to your transplant patient handbook. Do not drive until cleared by the transplant team. Do not drive if you are still taking narcotic pain medications. Do not lift more than 10 pounds for 6 weeks. Ask for assistance with lifting things such as groceries or pets. Do not drink alcohol. This includes non-alcoholic beers and wines. They still contain small amounts of alcohol. Alcohol is broken down by the liver and may cause liver damage, and sometimes liver failure. Mixing medications and alcohol can also harm your liver. Do not take drugs, including marijuana. Marijuana exposes your lungs to harmful fungi that can lead to life-threatening infections. Routine healthcare can help you prevent infections and diseases such as cancer and heart disease. Routine healthcare is especially important to transplant patients because they are more likely than others to get cancer and heart disease. With this in mind, keep up to date on screening exams such as colonoscopy, pap smears, mammograms, PSA tests, and testicular exams. Transplant patients are 10 times more likely to develop skin cancer due to immunosuppressive medications. Use sunscreen of SPF 30 or greater every time you go outside. Use lip balm. Wear wide-brimmed hats, long sleeves, and long pants. Do not smoke. Immunosuppressant medications make you more susceptible to cancers such as lung cancer. Smoking is linked to lung disease and many other cancers. Contact the transplant team for advice on smoking cessation. You may resume sexual activity when you are ready. Remember, always practice safe sex if you are not in a monogamous relationship. Barrier methods such as condoms and diaphragms are safe. Discuss with your provider safe birth control methods. If you are thinking about having a baby, talk to your transplant team. Some medications may be harmful to the baby and cause birth defects. Your medications may be altered to protect you, your liver, and your baby. Routine dental work should be done 6 months after your transplant. This includes having your teeth cleaned. However, if you have tooth or gum pain, you should see your dentist immediately. You will not need to take an antibiotic when you have dental work done unless your dentist deems necessary due to a possible infection. We follow the American Heart Association guidelines for dental prophylaxis. Ways to prevent infections. You do not need to wear a mask. You do need to wash your hands with soap and water often. Avoid direct contact with people who are sick. Ask sick friends to visit when they are well. Avoid raw or undercooked meats. Do not clean litter boxes or bird cages. Practice safe sex and keep up to date with all your immunizations. When to call? Contact your local provider and transplant nurse practitioner if you have any signs or symptoms of infection, are exposed to serious infections, develop a fever, or simply do not feel well. You may be prescribed antibiotics or be admitted to the hospital. If you develop a life-threatening problem like shortness of breath, crushing chest pain, or vomiting blood, call 911. Ask the emergency room team to consult with the transplant team. As a transplant patient, you should keep up to date with your immunizations. The recommended vaccinations include tetanus every 10 years, influenza vaccine every year, and per your provider's recommendations, a pneumonia vaccine. Transplant patients should not receive any live virus vaccinations such as measles, mumps, rubella, smallpox, chickenpox, shingles, nasal flu mist, or the oral polio vaccine. These vaccines can cause illness in transplant patients. You can receive a tetanus shot, diphtheria, pertussis, and the human papillomavirus. Transplant patients may receive flu shots, but not the nasal flu mist. the nasal flu mist is a live vaccine. If you are confused about a vaccine or are caring for children who receive a vaccine, refer to the Liver Transplant Handbook, Transplant Team, or your primary healthcare provider.
Nutrition during recovery. Hi, I'm Annie Lafferty, and I'm a dietitian at UCSF. Today, I would like to talk to you about nutrition after transplant. Nutrition plays a key role in recovery after liver transplant. As with any surgery, adequate calories, protein, vitamins, and minerals are needed for wound healing. Choosing nutrient-dense foods, including plant foods, whole grains, and dairy, can help with recovery instead of food considered empty calories, such as sodas and sweets. It is common to feel full after eating a small portion of a meal following transplant, so consider eating 6 small meals per day rather than 3 large meals. This will help with recovery. Protein is important and can come from plant foods such as beans, lentils, tofu, unsalted nut and nut butters. Protein can also come from lean and low-fat animal foods such as fish, meats, eggs, and dairy foods. Nutrition-related problems post-transplant. Many patients have nutrition-related problems in the months and years following their transplants. These include excessive weight gain, diabetes, bone loss resulting in osteoporosis, and high blood cholesterol. Some medications can be involved in the development of these complications, but diet and activity are critical in reducing these risk factors. Risks can be reduced by following a high-fiber, heart-healthy diet. An easy way to think of this is to eat a variety of plant foods, including fruits, vegetables, and whole grains. Also, try eating lean meats, chicken, fish, and low-fat milk products. Reading food labels will give you a wealth of information. When possible, limit animal products. Limit egg yolks to less than 4 per week and choose egg whites as an alternative. Avoid added sugars, saturated fats, and trans fats. Remember, calcium and vitamin D are important for bone health. Every day, try to incorporate 2 to 3 servings of calcium and vitamin D through milk, yogurt, soy milk, or tofu. If this is not possible, consider calcium and vitamin D supplements. Diabetes is a common problem after transplant. Some post-transplant medications may cause your blood sugar to rise. In your diet, limit concentrated sweets such as pastries, cookies, candy, ice cream, soda, and juice. Instead, choose a variety of fruits and vegetables and eat high-fiber snacks. High blood pressure may be a problem after transplant. Your medications and salt may cause fluid retention. To help alleviate this, avoid foods high in salt. To help manage high blood pressure, read food labels, avoid foods with added salt, and choose fresh, unprocessed foods that are less than 5% your daily value of sodium per serving. To prevent foodborne illness, practice good food safety by cooking meats and eggs until well done. Wash fresh fruits and vegetables well. Properly refrigerate items. Wash your hands before eating.
Reclaiming fitness. At UCSF, we strongly feel that regular physical activity is necessary after transplant for you to become as healthy and physically fit as possible. Everything you do to improve your overall health increases your chances of having a long life with your transplant. Inactivity or bed rest for long periods of time causes loss of muscle mass and strength. Immediately after returning home, you should walk every day. When the transplant team feels you are ready, you should create your own exercise program. See your liver transplant patient handbook. Who knows? With effort, patience, and perseverance, you may participate in the next U.S. Transplant Games. If you do not believe me, visit the 9-Long Solarium and see the transplant game medals won by and donated to UCSF by a UCSF transplant recipient.
Social workers. Hi, I'm Pauline Rogers, and I'm one of the social workers for the UCSF Liver Transplant Program. Many patients have questions about insurance, leave from work, and disability forms. The social workers can help you with your questions and help you navigate the paperwork. The social workers participate in your care throughout the transplant experience. They help in the pre-transplant evaluation. They facilitate a weekly liver transplant support group, monthly caregiver transplant support group, monthly hepatitis C support group, and also co-facilitate classes to prepare you and your caregivers for the transplant experience. After the transplant, the social workers will also be available on 9-Long and in the pre- and post-transplant clinics to help you with any questions that you may have.
Routine outpatient monitoring. The first 60 to 90 days after your transplant are the time of highest risk for rejection and infection. Consequently, you will need to have frequent blood tests, your vital signs need to be monitored closely, and you will need to be seen in the clinic. Plan to come to UCSF's Adult Liver Transplant Clinic on Tuesdays or Thursdays for the first 6 weeks after transplant, and less frequently over time until you need only annual visits. The Tuesday clinic is on the 6th floor of the Ambulatory Care Center at 400 Parnassus. The Thursday clinic is on the 7th floor. 400 Parnassus is the big black building across from the hospital. When you leave the hospital after your transplant, you will be given lab slips and an appointment date and time at the clinic. You will need to have your labs drawn twice a week, on Mondays and Thursdays. Kaiser patients have their labs drawn at a Kaiser lab. Non-Kaiser patients may have their labs drawn at their usual lab, but LabCorp or Quest or UCSF lab are preferred. In your liver transplant patient handbook, there is a chart to help you keep track of your blood test results and your vital signs. Your transplant team will let you know when you can decrease the frequency of your lab tests and clinic visits. Resources and contact information. The providers who took care of you before your transplant still have a role in your care after your transplant. You should make an appointment with your primary care provider within 1 to 3 months after you return home. After 3 months, your primary care provider will manage your non-transplant related drugs, even if we started them while you were in the hospital. Examples are your blood pressure pills, diabetes medications, and vitamin supplements. You should also continue to see those specialists who are involved in your care before your surgery. For example, your cardiologist or endocrinologist. Remember, contact the transplant office during business hours if new medications are prescribed by your local health care provider. These new medications may interact with your anti-rejection medications. For a medical problem related to your transplant, contact your transplant nurse practitioner. For non-transplant related health problems, contact your primary care provider. If you are very ill, call 911. Your family members can notify the transplant team that you needed to receive medical care quickly. The UCSF Liver Transplant Office is open Monday through Friday from 8 a.m. to 5 p.m. For non-emergency calls, call 1-800-LIVER-TX. The 24-hour urgent transplant number is 415-353-1888. If you call after hours, evenings, weekends, or holidays, a transplant surgeon will be paged. You have been given a great deal of information. No one learns all of this material in one sitting. Rewatch this DVD as often as you need. Most people need to read the Liver Transplant Handbook 3 times before they retain the information. The handbook and your medication card are your guide to a healthy post-transplant life.